Everybody is so different, of course, but most people will see a benefit when, just like working out, you are doing something consistently. So most people, 6 weeks. If you're really having a lot of breakouts and cystic acne, anything along those lines, you want to do 2 to 4 weeks. Yeah, and you really want to keep the barrier of the skin as clean as you possibly can and free of as many, we have to use products, but you want them to be as clean as possible. I'm going to do a hydrodermabrasion on you, and this is just going to kind of pull out any of the impurities in your skin, blackheads, pimples, dirt and debris that kind of just get stuck in the skin from environmental yuck and all the stuff that we use every day. This is something I would say I would encourage people to get at least every 4 to 6 weeks.
Oh, wow.
It's almost a vacuum, if you will, for the face. And you can specialize what serum you want to use. And so I'm using a little bit of a salicylic serum on you just to kill bacteria, kind of keep the acne at bay. You aren't having any real active breakout. I can see, like you said, congestion, not anything, real active here, which is good. But this really goes in and kind of helps pull out all the impurities. You really feel like you're clean.
Yeah.
And anything that feels too abrasive on you, just let me know.
Okay, yeah, this is great.
Good, okay. Yeah, it is. It's kind of an interesting feeling. Okay, so you are going to feel, this is pretty cold.
Okay.
It feels good. Okay. So this is a real thick serum that's going on your skin, and this is gonna really convert the carbon dioxide to oxygen. It's gonna help and really push into your skin.
Oh, wow.
This is what's really gonna help with the hyperpigmentation and really also helps to calm the skin as we're doing this.
It smells so
yeah, it's a beautiful, decadent, rich emollient, I guess you would say, or gel-like consistency. Do you feel like you have gone through a change with your skincare? Is it, I mean, with your skin, do you feel like it's different?
Oh, 100%. Just see a dryness, and the skin just looks really, really dull.
Yes.
And so I'll do what I can to, brighten up with whatever makeup look, or I'll even focus on more of a pigmented eye color. So I'll use a hot pink or a really bright orange, kind of a sunset eye, to really pull the attention away from the quality of my skin.
Got it.
And I think I'm really getting to a place where I want to have, a natural glow kind of from within, to where I'm not constantly, a slave to
having to do the heavy makeup.
And sometimes, it can look harsh depending on, what, if it's, just in the morning. I don't like to have to, have a glitter shadow at, 7 in the morning when I'm just going to church or something all the time.
Right. And do you feel like, I know when I was going through bariatric surgery and after, you have to really be careful what you're putting in your mouth. So yes, we want to have water, but that fills you up. And so then you have to wait another 30 minutes maybe to have a protein drink, or so it's often, I feel you when you say the dehydration is a real deal, because putting in the nutrients that you need and also getting in your water, it really takes a different level of planning for us than the average person.
It really does, and especially for, and bariatric patients, the majority are women, and so oftentimes women, it's not uncommon that we're juggling, 15 different plates at a time. And so when it comes to hydration, if it doesn't feel good, I mean, one of the things we know when we struggle with, morbid obesity is if it doesn't feel good, we don't do it. Well, how dangerous is that when it comes down to hydrating?
Sure.
And so we get that full feeling, and it makes drinking water, which may have not been prior to surgery, a problem. It makes it something that can create a discomfort in your pouch.
Yeah.
And that truthfully is, I think, what it's about, because then we'll find ourselves, for example, if you experiment with alcohol after surgery or soda,
sure,
magically we're able to suck that down like it's no problem. And I think it very much is mental.
Yeah.
And that, there's just discipline that has to be implemented when it comes to that as well. And it's another way of balancing and learning what you're going to stick to. So, also, as far as being malnourished, I think, dehydration just kind of leads right into malnourishment. And
Absolutely.
I think, tell me what you think about this. The conversation of, you're going to become vitamin deficient and malnourished after surgery. Sometimes we correlate that to looking gray or losing muscle density, but malnourishment can literally mean simply being deficient in, a few vitamins.
Right.
People think that, well, I'm not seeing a big difference in my skin. I'm not passing out. I'm not sick. I'm not malnourished.
Or I do look okay, so I am okay.
Right. And
then you go and get checked, and I remember the first time, kind of after I went in, and maybe not the first time, maybe a year later, and they told me I was malnourished, and I was like, oh, you're kidding me. I feel good. I feel like I'm looking good.
Right.
I didn't understand that you can be malnourished from not even having gastric bypass surgery. You're just not eating the correct foods, and you're malnourished.
Right.
So tell me, did you feel any kind of bubbling champagne effect?
I do.
Okay.
It definitely feels that there is, there's activation.
Yes, activation, absolutely. And it can feel a little bit pins and needles, if you will. That is the abrasive part of it.
There's some tingling.
Yeah, tingling.
For sure.
That's probably a better word for it. And so that effect is called the Bohr effect, that exchange of carbon dioxide that's now changing into oxygen, which is, just phenomenal for the skin. So I'm gonna take that part off of you, and we'll go on to the next step. The next step I'm going to do on you is actually a lifting and tightening.
Oh, wow.
Now, somebody your age probably doesn't feel like they need that, and some might not. But I would say most bariatric patients are going to see, and really everybody's going to see a benefit from this. So I'm going to put on a hyaluronic gel that's just going to help me kind of move across the face. This could be done with ultrasound gel, but I always feel like if we're doing anything, let's do it to help the skin. So hyaluronic acid is something that is in our skin, and we're losing it as we age. It's just not a fun thing, and it's what helps kind of keep our skin plump and hydrated. So
Oh, wow.
why not put it right back into the skin?
Yeah, I've heard that word, and it seems to be, you know, a buzzword in
It is.
in the skincare community
Definitely.
right now.
And it's because it really does have an active way of holding moisture in your skin and really plumping you, and that's something we all need. By 28, you're losing hyaluronic acid exponentially.
Oh, okay.
So this, you may feel a little warmth
Okay.
coming. If it feels too warm, let me know.
Okay.
And this is just kind of going in and lifting that skin up. And I think, again, with the bariatric patients, that's an issue for a lot of us. We are battling elasticity issues. I know that for myself, that was something I saw pretty quickly. When you're losing weight in a manner that you do with the bypass or gastric or sleeve, whatever process you go through, that change in your skin happens quick. And again, that hydration is key, so important. But definitely, I think if you're really having some serious outbreaks and skin issues, I think one of the things that I see a lot is something called PCOS, polycystic ovarian syndrome.
Yes.
And that can cause weight loss, it can cause weight gain, it can cause hair to grow on the face, more than, dark, thick. It can cause cystic acne. And those are things that I would refer out, of course, to a dermatologist and to an integrative. For me, I think an integrative medicine doctor that really can kind of go over your history and kind of map what's going on within your body is a great way to figure out what's happening with the hormones. Sometimes you don't get that with your primary care.
Right.
But you definitely want to investigate that. If you are really having serious skin conditions like that, I would hope any esthetician that you're going to would refer you out to the right specialist for something like that.
Right. If you had to break down, a step-by-step system, just from go.
Sure.
We talked about, clean eating as well as, activity and hydration, making sure that that's all in tune. But what would you recommend to, just the average
daily care?
Girl,
So again, everything is so specific to each person, but let's go with you at this point. So for you, what I would recommend is washing with a salicylic acid. That's gonna help kind of kill any bacteria that's on the skin. It's really going to prep your skin for what you're doing next. And you wanna keep your system as simple as possible, but use what you need. So I think a good salicylic for you, and then I personally would recommend, I have a CBD infused oil that I use that's got hyaluronic in it, it's got rosehip oil, it's got fractionated coconut oil, and it's got CBD. And we'll talk about that a little bit more, but it is something that I have found in here. There is nobody that I don't use it on. I use it on my acneic clients, I use it on my anti-aging clients, and everybody in between. It helps with inflammation, it helps brighten the skin. It's taken the place of having 4 different things that we have to use. So it's really something that I am thrilled about. It's made locally, and it's farmed locally, and it's handcrafted, and yeah. So when people come in and tell me they're using something, I always ask them, how's it working for you? Do you see a difference? Are you seeing an improvement? And a good portion of people will say, I did for 2 months, and now it's not working for me anymore. And so all of these products, if they're working and you feel like they're something that you're seeing a difference with your skin, go for it. I think oftentimes after about 2 months, you're not seeing that anymore. The other thing that I think is interesting is to, again, go through with each of those lines and check out the ingredients list. You might be surprised. A lot of them come off as being very clean, and they're not. The third thing is they're often more expensive than what you can get through your esthetician.
Wow, really?
Yeah, it's shocking to me that, and you're getting more of an active ingredient when you're buying in here, essentially. So I don't poo-poo, if you will, any specific brand, because I think things can work for different people, but I think it's important to figure out if they're clean, if they're really doing what they're saying they do, and look at the cost. I mean, if it's exponentially more than what you can get in your esthetician's office or a doctor's office, I mean, you might want to really consider getting those active products. Yeah. So what I just put on you now, this is such a fun mask. It's almost a probiotic, if you will, for the skin. And it's just gonna go in and deeply, it's gonna occlude the skin so that the oil that I used on you is going to be pushed in even deeper. And you might even feel like your skin gets cool. And that, again, goes in and helps with the inflammation. And we just kind of leave it on for 10-15 minutes, and then we'll peel it off like a face off.
Okay, cool.
So I'm gonna do what's called cryospheres, but really they're blue balls, okay?
Oh.
And they're just,
all about it.
Yeah, they're just refrigerated, and they're really gonna, again, speak to the inflammation in the skin. Really feels good after treatment of kind of any kind.
Oh, I can hear them.
Yeah.
Oh, this is
Heavenly, right?
yes.
Yeah.
Oh my gosh.
So I like to do these in every treatment I do, but really great when their skin's kind of inflamed or they're having any kind of outbreak. These are great even to have at home. Helps with headaches, helps any kind of inflammation anywhere, really. So we're gonna peel this off. This is extremely satisfying for me. But this is really something that you can come in and get often, and it just is so nice on the skin. It just feels so good, and it's just fantastic for you. So it's really helped me to kind of push that serum into the skin. And open your eyes and check this baby out.
Oh my gosh.
Yeah.
Do you see the difference in her skin?
Especially on camera.
Let me see.
Wow. Hey, I love hearing that.
Are you getting so excited? Well, I walk into the most gorgeous Hobby Lobby esthetician's office. It is the most beautiful.
It is very Hobby Lobby in here,
Pinterest.
isn't it?
Oh my gosh.
Yeah, she did a good job.
It's so I think for so many women, it's so satisfying to walk in.
Yeah,
Because
relaxing.
And it looks like a little boutique.
Yeah, So I'm gonna use this next product on you is kind of what I talked about a little bit before. This is called Liquid Light. It's a botanical face oil. It's what's got the CBD in it, the hyaluronic, fractionated coconut oil, and rose hip oil. I mean, it's got everything. So you'll smell it. It smells like the earth for sure.
And someone like me, I am such an aroma therapy girl.
Me too. So this is what we call gua sha therapy, and it's kind of retoning the face with specific placement of this tool, and a very old therapy, but works fantastic. This is again going to help with lymphatic drainage in the skin. And people have completely different kind of techniques. You just kind of find your groove. But this is something I like to send home with clients. This tool along with the Liquid Light to kind of do daily, or every other day, whatever you can. And it just kind of wakes the skin up, brings kind of that rosy hue to the surface of the skin, and you like immediately see a lifting and toning with it. So I'm gonna hand you the mirror and let you kind of see the finishing touches here.
Oh my gosh, I love it.
So for me, the first thing I kind of notice is the glows back to your skin. It's kind of taken that dullness off. What do you notice?
So right away I'm noticing underneath the eye is so much more blended into my skin, and I can't see so much of the contrast from my lower eye bags, kind of like that purple hue.
Yeah, the sallow.